Welcome. I'm so glad that you're here, Alissa. This is Alissa Gargano, and she is an SLP and an RDI consultant like me, but in Australia. And it is so exciting to have you here, Alissa, because you have experience with safe and sound protocol. And I was really hoping that you could talk a little bit about that to for everybody to hear. But first, would you like to just introduce who you are, like what brought you here, that kind of thing?
Sure. So as Heide said, I'm a speech pathologist here in Sydney. So you're seeing me from my rooms in Sydney. And I also am an RDI consultant, which I've been doing, funnily enough, Heide, I counted up it's like 7 or 8 years now. It's just gone like that of RDI. So anyway, I actually came across the Safe and Sound protocol in quite a strange way because I had colleagues from Singapore, colleagues from Sydney, all talking about it at around about the same time. And it got me thinking, what is this? So I started looking into it and have been doing that with clients. So yeah, that's how I came to be, a little bit of a weird way. It's just one of these things that kind of hit everyone at about the same time. We were all talking about it, and we've been working with the program for a few years now.
Okay, so that is really cool. Then I'm so glad that you agreed to talk about it because you do have some experience with it, whereas I have none yet.
Oh, right. Yet, yes, that's right. Maybe you will want more after we've talked about it.
Exactly, exactly. So what exactly is safe and sound protocol?
I think that is always the key question I'm working hard to try and answer, because the program itself sounds really weird when you talk about it. So what I'll do is try and describe to you how I understand it and like the box I've put it in my head,
That'd
because
be
it's
great.
a little bit left of center. Okay.
Okay.
So we're talking about something called polyvagal theory, which was by Stephen Porges a couple of years ago now. And what he's talking about specifically is the autonomic nervous system, which I guess most people would know a little bit of nervous system. We have one. It does stuff. So with this one, it's the vagus nerve that is really kind of remembering these responses that can tip you into fight or flight, or another one that's called freeze. So a lot of people have heard of fight or flight,
Yeah.
but freeze is another one that's kind of related. So this is what our nervous system is supposed to do. In mammals, it's what we're supposed to do. When you have these responses, that's because your nervous system is doing what it's supposed to do. So a really big thing that I like to keep in mind from this theory of Dr. Porges is that it's nothing to be ashamed of. It's nothing to be scared of. Your system is supposed to do it. However, what also your system is supposed to do is get back to like a normal regulated state. So the idea being you would get, say, elevated when stress comes, you work through that experience, and then when the experience is over, you come back to your regulated state.
Right.
But when your nervous system is sitting in these autonomic states, perhaps really often, perhaps for longer than it should be, that vagus nerve kind of remembers it, and you start to get primed to see stress everywhere, and you can tip into this state when there's actually no need for you to do it. And this comes at a price. It's very taxing on your body to be in this state for a long time. So when we're thinking about our kids with a vulnerable nervous system, I think of it as this, as someone who is in these states a little too often, and it's costing them. They're losing opportunities to learn. They're losing opportunities perhaps to feel connected to people, and just to feel really good in your own skin. I think if you're not, any of us who can imagine being stressed know that it's not a great feeling.
Mm.
And we know then how great it is when we get back to feeling calm, feeling connected, feeling regulated, not necessarily calm, but being able to feel kind of like back in control of what's happening, back making sense of, my mind feels okay in my body. Yeah.
Yeah. Wow, that's a great description. That's actually one of
Oh,
the
I hope
best.
so. I'm working on it.
Yeah, okay, that helps me. Um, so then So that's what it's based on.
That's
Safe.
what it's based on. So this would be the theory of why we need a program like SSP. So what SSP is doing is you've got your headphones on, there's music coming through, but the music has been engineered with a specific kind of filtering that gets into that vagus nerve, that autonomic nervous system. So there's actually part of that nerve that's in our middle ear. So
Okay.
using this music and using this filter, it's kind of like an in to that nervous system. And the idea is that it's going to kind of help with readjusting those memories or those presets that have developed in your nervous system.
Okay.
Now, that's a bold claim. It is a
Yeah.
very bold claim, and there is quite a number of caveats around it. But generally speaking, if I'm to paint a very, very big picture, that's the idea of it. That's the rationale.
Okay.
So the caveat being that this is not a silver bullet. Even SSP creator Dr. Porges will say it's not a silver bullet. It's a small part of a wider management plan to help with managing your nervous system, the vulnerabilities that have come up because this may be a barrier for a person. And there's certain conditions about how we would set up this program to try and get to that point. But yeah, not a silver bullet is something that always stays in my head, that it's part of what we do. It's not the whole thing that we do.
Okay, so that's really good to know. It's not like you can't just do it alone and expect to see huge results.
That's
You,
right. It's not a standalone treatment. It was never designed to be. The research is not supporting that that's the case. But it's always good to know that going into a new treatment. You know, we pin our hopes on these things, and
yes.
that's probably misguided in the case of putting all your hopes into the SSP basket. No, it is one thing that can really help you get access to more of the benefits from that other therapy, though. And that is the thing that SSP is really aiming to do. So
So
if
it's
we,
kind of opening up, calming your system so that you can be alert and ready to learn.
yes, yeah.
Ah, okay.
In our RDI world, we would think of it as opening up some of the barriers to guiding, opening up some of the barriers that may be existing to co-regulation. And
Right.
that's where the SSP can fit in. I mean, if I wear my hat as an RDI consultant, it fits in. If I put on the speechy hat, it fits in with there too, because you also can't have communication and you can't have language if you don't have this ability to connect and co-regulate. That's all part of it. So
Right.
if your vulnerable nervous system is a barrier to accessing the benefits of these therapies, accessing the benefit of the guiding relationship with a parent, SSP can play a part in helping reduce that barrier.
Right.
It's a part of it. Not the
Yeah.
whole thing, but it's a part. And it can be a part that's quite significant.
Okay. 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 Wow. I'm really gaining a better understanding. This is great. Um, so you were saying that it has to be set up in a specific way. Like it's not just that you put on headphones and you listen to music. It's
Yeah,
a
if only it were
special
that
kind of
simple, right?
music.
It's a special kind of music.
Okay.
It's filtered to help you access actually a lot of the frequencies within the what we call the speech banana. So
Okay.
if we look at sound frequencies, you can actually map out where the frequencies are of human speech, and it's kind of shaped like a banana. So yeah,
Yeah.
very imaginative. We call it the speech banana. That's part of it, and it's helping to reduce the sensitivities that someone might be having because of these autonomic nervous system states. So it could be things like you're very sensitive to noise, or what we would call an auditory sensitivity.
Mhm.
It could be that you're perhaps a little bit anxious going into this, I mean, I think we might call it a brain fart. When we just go, wait, so we got too unexpected and I'm just freezing for a second. That's a very mild freeze response. If your child's quite reactive, that could be the fight or flight. If these things are getting in the way, and by the way, what I've just described is very all in a china shop examples. They're quite easy to see. it's not always that easy to see. And in my experience, it's hardly ever that easy to see. There are all these subtle cues that we might miss because a child is in fight, flight, or freeze.
Okay.
But we would start to get a sense that it's a barrier to accessing therapy and that there might be a place for SSP.
Right.
Yeah. If you speak to
So
an SSP therapist, they're going to help you know, because part of what we do is we want to map out what does it look like so that we can measure if it's getting better over time.
right,
Yeah.
right.
We
So
got lost in question. Sorry, I don't know where we started and I've meandered off. I'm sorry about that.
no, that's okay. That's okay. This is great. So, okay, so how does a program look?
So a program looks with you would do the program with someone who is specifically trained and authorized to give this SSP program. So you would have to find an SSP therapist, step number one.
Okay.
May find if you've got a speechy, an OT, a psychologist, they may well be SSP trained. So it always pays to us because there's growing numbers of us around. As more of us find this program, more of us are offering it. So always check, and if not, they might know someone who is that they could recommend you, but that has to happen first. Then we need to set up the listening sessions themselves. And there are a few different options of how those sessions might look. We have different levels of filtering in different programs, and the SSP consultant will work with you to try and pick the right level of filtering. And that will also then determine how long the sessions go for. Now, both in duration and in frequency. And really, you could be doing these for a week, you could be doing this for a year. It really depends on how your nervous system is going to engage. But that's why you need the SSP trained person to work with.
Okay.
So that's
So
number
it's
two.
not just something where you can go, oh, okay, I got the equipment and I'm just going to put these headphones on my child or on myself and
Yeah.
I'll be good to go.
Yeah, I would be a little bit worried and hesitant about doing it like that, because imagine too, yeah, okay, headphones and music, press play. It sounds pretty simple, but everything else that I've just described about the nervous system is getting a bit complex. So you want to have someone who's got a little bit of knowledge about how that might look and how the program is going to look as you progress through. So when I'm working with a client on the SSP program, normally they're going to be, I work with children primarily. So I'm really doing this with children. So
Yeah.
I work with parents for them to set up listening sessions at home. Now that sounds a bit weird because I've just said I'm an SSP therapist and you think I'm in there doing the headphones with you, right? But no, because the SSP actually stands for Safe and Sound Protocol, and they have purposely put safe first because safety is the first thing we need to set up for. Now, even when we use that term, it's something different in this SSP polyvagal theory world. It's not, are there spiders around? You can tell I'm from Australia when I jump straight to spiders, right? There are spiders around because that's dangerous. Okay, yes, that's safety in one sense. That's like a physical safety. Is there threat around? What we're talking about is felt safety.
Okay.
That's a whole other thing. We could have a whole other session just on felt safety. And I actually think that you have one planned coming up with Robin Gobble at some point. So I dare not talk about it when she is the guru of felt safety. And yeah, you could just put that one on there. But essentially what it is does inside your body feel safe? Does outside your body feel safe? Is there safety between us and me and the people around here and me and my world? How are these interacting? And it's very subjective.
Yeah.
So chances are your child, if you're looking down this SSP road, chances are your child doesn't have a great deal of felt safety a lot of the time. They may well have it sometime. And I'm sure they would have it sometime, probably when they're at home with parents, safe person, safe place. So that's why I like to do it that way. We have a really cozy spot at home. We have your safe people. In terms of getting that first S, this to me is probably the way to do it.
Okay.
However, I am still in there. I'm just not in the room with you. So what I do is set up a session with the parents and we have a detailed talk. How do these sessions look like? What activities are going to feel safe that you can do? Where are you going to be sitting that's going to help for felt safety? What are you going to be doing with your child here? And like, we want to reduce the demands to create felt safety. We want to have an interesting and fun activity that's not too mentally challenging, because that's not going to be felt safety either. That's something else. It's not unsafe, but it's just something else that we need right now. So
Yeah.
setting this up actually becomes quite technical. And then we have to figure out, how long can this session go for? There's a bit of trial and error, perhaps. We tend to be erring on the side of caution when we're delivering SSP, because this is not the type of program that we want you to push through and get it done. And parents are going to be given specific instruction on what their child's behavior is telling them about their nervous system. And when do we pause? What do we do when we pause? When do we come back? When do we stop? And in between each session, after each session, we have a call or a Zoom meeting, and we go, right, we pull this apart. How did it go? And make a plan for what we're going to do in the next day or two for the next listening session. Now, some children may make it through 30 minutes, an hour. Some children may make it through 30 seconds, a minute.
Oh,
So
wow.
now we need to figure out, where does that sit and how do we set this up? So it's important that you've got that person to be coming back to, and the check-in after each listening session is quite key.
Okay, so there's a check-in after each time. And
Yeah,
will
after
the
it,
listening sessions happen every day?
maybe. The answer would be it depends. Yeah. So when they first set up the SSP program, it
Mhm.
was very prescriptive. And I got a speech here, I can't say the words. I've been talking too much. So it was very prescriptive. And what it was 1 hour, 5 consecutive days. So you would really like get through it in a week.
Yeah.
But having that, they do a lot of research, and they always, even ongoing, still do research on, what is this program doing? Is this doing what we think it's doing? What are the key points that we need to keep, and what are the key points that are not worth keeping? And this 1 hour, 5 days a week, they have realized is not really, it doesn't make much difference. What does make difference is being able to tailor it around the child's felt safety. So
Oh,
what that means is, we're better off doing 5 minutes a day for 3 months, or, I mean, I don't do head maths. I don't know if that adds up to 5 hours, but, and maybe do a little bit a week or whatever, that doesn't make a difference to reaching your goals with this program. Pushing through, even if you don't have the felt safety condition, it jeopardizes the success of the program. It actually gets in the way. So
wow.
this is why you have flexibility, but with that, you have to be working with someone who knows how to interpret that and to help guide you as a parent through it, so that you're going to get the most out of the program.
Oh, wow. Did not realize it required that much input. Right. Mhm. So in this, the parent has to stay with the child then
Yeah, someone
during
has
the
to stay.
listening time.
Yeah, so that would be a safe person. So the reason I would tend to do it with parents is that they're going to be safe people.
Right.
Um, but it can be anyone who's a safe person.
Okay.
Yeah.
Would
As
it
long as
have
it's
to be the same person?
safety. No, I don't think it would necessarily have to be the same person. I would just want it to be a person who I have worked with, who knows how to set up those sessions. Yeah. So I
Yeah.
have done it with both mum and dad, both doing some sessions. I think that's fine, as long as, yeah, but they have both been involved in all parts of the program. So even then, if I'm doing the check-ins, it's both parents checking in. So you know what happened the day before. And then we plan, well, who's going to do it the next day? And it's involving all three of us then.
Right.
Yeah.
Right. Okay. And ideally that would be great. And then you mentioned something about activities that you do. So this isn't just listening. This is actually doing
Oh,
something.
there's doing something as well. So the activity you're doing is, again, it's focused on having the child doing an activity that creates felt safety. So a preferred activity that's not challenging for them. So not like maths homework. No, I mean, I say maths homework, I can already feel my nervous system.
I know.
It's a long time since high school, but that's how much it traumatized me. Yeah. But no, so something that's going to be needing too many of your thinking resources, essentially. Something that's a bit of fun. It's not too hard. Something the child can do quite easily. They can do it on their own if they want to. You don't have to play it with them. You're there as the safe person. You can, or you could just play next to them. That doesn't really matter too much, as long as it's something that's low demand. And the
Okay.
reason for that is that we want those resources allocated to doing the vagus nerve work when you've got the headphones on. We don't want to take resources away from that.
Okay. So a question, why headphones on and not just in the room? Like,
Oh, this is a good question, because some kids can't tolerate headphones, right?
yeah.
So yeah, purely for me, it's just easier to have headphones on. But I have had clients that haven't been able to tolerate it yet. So we can set up speakers. It's a little bit more of a setup, to be honest. I think what I didn't really understand at my early days of SSP is you've got to have the two speakers set up so that they go in each ear.
Ah, okay.
Yeah, I mean, if you've got a child who moves around a lot, this gets quite tricky, whereas headphones always going to be on each ear. And you can get headphones now that don't even have cords attached. So that's, if your child likes to move around and that's part of what they're doing, that's absolutely okay. Some kids do that to get felt safety. And if they're doing that and they have headphones on, it just, the logistics are much easier.
Okay. I've also heard,
We do have answers too. If a child is not coping with the headphones, we can actually work up to that with some less filtered music. But yeah, if we need to do it with speakers, we can. The only other thing that I think about with that is that, and look, I think you'd have different SSP practitioners doing it differently, but I don't love the idea of a parent doing the program at the same time as the child.
I was going to ask about that. I have heard that um the parent then puts like earplugs in or something so
Oh
that
yeah,
they're
you might have heard that from me, because that's what I would do if it was in the speakers. But it's interesting if you've heard that from someone else. It sort of it firms my thought on this one. Yeah, and there's a reason for it. It's not to withhold the program or anything like that, not at all. It's just about the fact that you are both having reorganization of your nervous system at the same time. And this is a lot of work. So sometimes with SSP, you start to see behaviors that perhaps make you think this is getting worse, but actually kind of tells you that it's working, because what you're observing there is reorganization. So
oh,
yeah, it might look like dysregulation, but if it's dysregulation in the context of we're doing SSP this week or this fortnight, it's actually not unexpected, and it's just a way to let you know, yeah, the reorganization is happening. And this can happen even up to 6 weeks after finishing the SSP. So
okay.
what I don't want is a parent who's perhaps getting a little dysregulated and also trying to deal with their child's dysregulation. So if I do see a parent that perhaps is interested in doing it, I would have them stagger it, and I would have them do it at a different time.
Okay.
So
With a
that's why
different
I'm saying
safe.
maybe put the earplugs in, so you don't have the filtering music going into your autonomic nervous system as well.
Okay, so
Yeah.
that's a good point. And that parent, like if it's done with an app or an adult doing this, they would need a safe person also,
Yes, that's right.
right? And the child can't be that person because
Yeah.
the child
That's
can't, yeah,
that's not really
notice
an
the
appropriate
signs
role
and stuff.
of a child. Yeah.
Yeah, it's
Yeah.
not their role. It has to be like a person that I, as an adult, feel safe with, right?
And what my suggestion would be, if it's an adult, is I think you should do it with your psychologist or SSP person in the room with you. Because by the time, think about a lifetime of experience that's affected your autonomic nervous system, there can be some really unexpected things that can happen with an adult. It's not impossible, it's just a little bit more complex. And for me, if an adult wants to do it, I would recommend them to see their own therapist and do it with them in the
Okay.
room. That would be the safe person. I
Okay.
mean, you could have someone else in the room too. Like if you wanted to have your spouse in there, that's great. If you feel safe with them, have them in there, have at it. But definitely have that person in the room with you in case let's say your freeze response is really severe. You need someone has to step in and regulate with you straight away. That's better. That's a professional person who knows what that looks like before it gets to that point.
Yeah.
And we simply don't know. Like the another thing that Paul just says is he talks about trauma, which, okay, we can talk about that word in a minute. For children, it's obviously a word that we throw around, needs to be thought about. But if we're talking about trauma in the sense that Dr. Porges is, one caveat that he says is it's not the event, it's how you internalize the event, how you made sense of the event, how you experience the event. And that's your autonomic nervous system. So two people can have a very similar experience and have a very different nervous system response to it. So with adults, there's potentially a lot of these, and you've gotten on with your life, you don't know, and then SSP comes in, starts rejigging things around. Yeah. Now, this is not so risky with children because they just have not had the same amount of experience.
Yeah. Yeah.
For the most part, they've had their parents around helping them make sense of it, helping them co-regulate. So, yeah.
Yeah. Yeah. Okay. Wow. Very interesting. So what we're saying then too is age is not a barrier.
No, age isn't a barrier. There's research for all ages. Um, the one that I have heard a little bit is that SSP is not appropriate for very young children, but there is research for that as well. If you can get the headphones on them, or you can have the setup with the speakers, if you're very savvier than me, then you could do that. It's not a barrier to accessing it because we have the nervous system when we're born. We have the nervous system even before we're born, actually. So yeah, you can do it with very young children. It's not going to hurt them. It's going to, it's going to have the same benefit to the nervous system. You can have adults doing it. Bit more complex, but definitely doable. And in fact, SSP, and when it first started, was purely made for adults. It was the vulnerable nervous system of some of our children that's come up as they've been researching it, and now is quite a large portion of clients that would access this.
Okay.
Yeah.
Okay, so that's really awesome. So really, I mean, I've seen things out there, saying stuff like, well, it doesn't really work, or it made my child worse, little things like that might make somebody go, oh, I don't want to do
Yeah.
this. What do you
And I've
have you
seen
got to
those
say about
ones
that?
too.
Yeah.
Yeah, I've seen those ones too. So I have had a little think about it. I think there was one that I saw. I mean, we're going back a little while now, and I saw that it was quite a litany of why it didn't work. But when you pulled on that thread and read the whole post, what this person had done is somehow got access to the filtered music and listened to it without an SSP consultant, without a safe person. They just put the headphones on and listened to it. And yeah, all of that talk that I just gave about setup, which is so important, I feel was likely missing. So that I don't know if, it didn't work for that person. I mean, what does that mean, first of all? But they certainly were not set up to access the benefit from the program in that sense. So it was probably a wasted opportunity more than anything else.
Yeah.
But this, as we're talking and you ask me that question, I'm also just thinking, what does work mean for people that say it didn't work? Like for clients that have done it,
Yeah.
I think there's a temptation to hear SSP and hear nervous system and think, oh, great, this will fix it.
Yeah.
I mean, your nervous system probably doesn't need to be fixed for starters. What does that even mean? Because none of us, even with very healthy nervous systems, are regulated all the time.
Yeah.
A good nervous system would have a large window of regulation, meaning you could feel a lot of emotions without it tipping you over into fight, flight, or freeze. But even the best nervous system is going to go there sometimes.
Yeah. That's
And
a good point.
why? Yeah. Why? Because that's what it's supposed to do.
Yeah.
That's what a healthy nervous system does. and how you bounce back and then get back to your window and what that means to you. Yeah. So you might need even your therapist that you're working with who's making that recommendation, perhaps framing that for you in a way that you understand, or you going in with your eyes open about what it means. Now, the other thing that I don't know if I said this already, but Porges is very, very clear in saying this is not a standalone treatment. I think we talked about that,
Yeah,
didn't
we
we?
did, right? And that's the thing, right?
Yeah. Yeah,
It
it's about increasing your access to your other therapies. So does it work? Well, that's a very long and individual question. Yeah.
yeah.
Now, the other part I think that you were speaking about was it made it worse.
Yes.
That to me probably likely to this reorganizing and refractory period that happens sometimes during and sometimes after SSP. So your child might look more dysregulated, but that is, again, it's like that kind of shows you that this reorganization is happening, right?
Yeah.
And for a few weeks after, it may keep happening. That's how you know it's working, which is really not reassuring words for a parent
No.
who's with their kid just losing it.
So
Yeah,
what do you expect? Like, what are some things that you should expect or may happen
yeah, good
this
question.
process? How about that?
Yeah, you do have to know this going in, and whoever's the SSP working with you needs to make this clear as well. So, look, my anecdotal evidence in my caseload, I haven't had too many kids get more dysregulated.
Okay.
I have had some.
Mhm.
I have had some, and because we're doing check-ins all the time, and in that case, we'd be doing check-ins after as well during that refractory period. So I'm here to support parents in the midst of that. However, something interesting also sometimes happens alongside this dysregulation, that the social engagement has increased. Now, that's something we do want to happen from SSP. We want to open up the social engagement system. So
Yeah.
if you think of these autonomic fight, flight, freeze as being this system here, the one system that comes in to mitigate this is the social engagement system. In RDI, we call it co-regulation.
Yeah. Yeah.
So if your child is more open to co-regulation, theoretically, these are easier to manage. And that is what I have heard parents report happening, which
Okay.
is just wild. Like my kid was more dysregulated, but actually they were more open to coming to me and telling me that. They were showing me that. They were letting me comfort them because the social engagement system opened up at the same time. Now that is wild.
That is crazy wonderful.
Yeah. And that's really what we want, because this increased social engagement,
Yeah.
the opening up of that system, is what's going to help with the nervous system in the first place. It's what's going to allow you more access to your other therapies in the other sense. So yeah, that's kind of how it could fit in.
Okay. Wow. Okay.
The only other thing I would add to it is that other thing we know is that for a lot of people, it doesn't last, and you need to do a few rounds of SSP. Now, you wouldn't be doing them majorly close together. Once every 3 months would be the most frequent you would have.
Like a
But
whole round or something different?
yeah, just doing the program again. So you might need to come back and do a round of it. Now, once you're working with your SSP, what's the word? Practitioner. I don't know what the word is.
Yeah.
Talking too much. But once you're working with that person who's helping you, really tune in and clock what your child's nervous system is doing,
Yeah.
it's then going to be easier for you to know when is it time to come in and do another round of SSP. We also have other programs now where there's different levels of filtering. So maybe you bring in not the full filtered music, maybe you bring in another one that's a little bit less filtered, but you do it every day for a longer time, and you can work with your SSP person to try and figure out what's going to suit best. But we
So
have
it's
that
kind of like
ability.
a rebalancing, like kind of
Yeah,
check.
and I think that program is called Balance, if I'm
Oh,
not
hey.
wrong. Yeah.
Okay.
Yeah, it is. So we want to figure out which level of filtering, how often is going to work for the most amount of time. So sometimes you're mixing these programs. Sometimes you'll just be on one, then you might be on nothing for a while, and you might be on one again. And we figure this out a lot by trial and error, but a lot by observing what is this child's behavior telling me about what their nervous system is doing right now.
Mhm.
And yeah.
Okay, so then is that like years of rebalancing, or do you know, like, does it ever come to a point where like, okay, we're done
I
now?
think if it were years, for, I think for years it would be maybe off and on. It wouldn't be years of constant listening.
Okay.
However, if that works for some kids, they might want to do that.
Yeah.
And it's something that can come in and out. If you don't need it because your nervous system is able to regulate for the most part appropriately, like you're not getting these knock-on downstream impairments from chronic stress.
Yeah.
If you're accessing the benefit of these therapist guides and parents around you, yeah, you might not need SSP then.
Okay.
Yeah, it's not going to hurt you at that point, but you might not need it. So then something might happen or something changes and you think, oh, I need another round again.
Yeah.
Yeah.
Yeah. Okay. Wow, this is wonderful. Alyssa, I really
Yeah, we have
appreciate
so much to talk about with SSP.
there's so much to talk about.
I
And
know.
I've learned so much today. And
Oh,
so if anybody has questions or anything, um, you can post them in the comment section and I'll ask Alyssa.
yeah, please. I'll try my best to answer in as few words as possible. Not my strength, as you can tell. Yeah.
It was perfect. Thank you so, so, so much for your time. And I'm so glad it worked out. You
I
can
know.
appreciate the time change that we are dealing with to try and figure out who's available at which time. And it worked and it was wonderful. So I so appreciate the time that you spent with me here today. And I'm so excited for parents and teachers and therapists to hear a little bit, well, a lot actually, about safe and sound protocol and make some decisions on, is this something that they feel that their child or themselves feel would be useful to try out. So thank you again for coming.
Thanks for inviting me. It's an honor.
Awesome.